Hi everyone, my name is Aileen Diccion, and I'm one of two of the breast health nurse navigators in the Cancer Center at Capitol Health. And I'm just going to talk to you a little bit about screening for breast cancer tonight. So the role of the breast navigator, it's not very easily defined, but basically we walk the journey with our patients. We provide resources to help overcome barriers to care, and we do our best to empower our patients to give them some control of certain aspects of their cancer journey. We do work with our support staff team to help. So we have a financial navigator, social worker, patient navigators, and our nutritionist, which you'll hear from Melissa. She's one of our nutritionists in just a little bit. And we work together as a team to assist patients when they need help or feel lost. So this is just an estimated number of cancer survivors in the United States from 1977 to 2022. And you can see not only do we have more survivors, but survivors are living longer, which is good news. So what increases one risk of breast cancer? So increasing age. I'm sorry, my screen is a little funny here. Increasing age, ethnicity, so Ashkenazi Jewish descent, reproductive history, so younger age at your first period, not having any children, or being a little older in age with the birth of your first child. There are some other things that factor in. So history of atypical hyperplasia, ductal or lobular, history of lobular carcinoma in situ, so LCIS, the number of breast biopsies that a patient has had, and then breast density. Those are all taken into consideration. So there are some ways to reduce the risk of breast cancer. Your provider may offer a risk-reducing agents such as tamoxifen. Surgery might be offered as well. But what's really important is living a healthy lifestyle. So limiting alcohol consumption is very important. It's recommended to have no more than one drink a day for women, but less is better. Let's see, exercise is also very important. The recommendation is for about 150 minutes of moderate activity per week. And weight control kind of goes along with exercise, and then breastfeeding. So we also look at family history. Only about 8 to 10% of breast cancer diagnosed are due to genetics. So we do take a look at a person's family history. We look at the first line relatives, so mother, sister, daughter, and we do go back a couple of generations as well. So we can look at grandparents. And we also look at the age of diagnosis of that family member. So if they're diagnosed a little bit younger, it may increase the risk of breast cancer a little bit. So who do we test? Who do we recommend for genetic testing? Anyone who's diagnosed with early onset breast cancer. So anyone who is diagnosed at age 50 or younger, we usually refer to our genetics department. Anyone with breast, ovarian, and or pancreatic cancer in the family history of 2 or more relatives. Those who are diagnosed with bilateral breast cancer, multiple breast cancers, any male breast cancer at any age, Ashkenazi Jewish background with breast or ovarian cancer, those unfortunate individuals who are diagnosed with breast and ovarian cancer, triple negative breast cancer, and follicular thyroid and gastric cancers. It's important to know that anyone who's had genetic testing more than 5 years ago, it's worth considering retesting. There's new information out there, new tests, so it's worth it to talk to your provider about that. And then there are tests out there like 23andMe that people do that are not considered genetic testing. They're fun to do. They give you some information about your bloodline, but they don't test for genetic mutations. So if you're looking for genetic testing, it's best to go to a genetic counselor. So why genetic testing isn't simply just a blood test. We don't just send people to the lab for a blood test. We do have a genetic department here at Capitol Health, and we do have a counselor, and they perform modeling and risk assessment. They do a full assessment of other hereditary cancer syndromes. So it's kind of like a family tree of genes. They're aware of the new tests and testing, and they help you to select the right test for you. And there is follow-up with our genetic counselors. So you don't just get the results of your testing, but the genetic counselor will kind of go over the implications for the patient and the family as well. And we do have access to research trials if you're interested in that. So this is a little bit about breast anatomy. You know, as women, we hear about these terms all the time, but not everyone knows exactly what this looks like. So lymph nodes, if you can see on the picture, it's basically a system of nodes that goes throughout the body, but this is where the lymph nodes are located in the breast. The areola is that darkened area around the nipple. And in the breast, it's comprised of blood vessels, fatty tissue, ducts, and lobules, which are the glands that produce milk. So clinical breast exams should be done by a professional, whether it be your primary care provider or a gynecologist, and it also should be done at least once a year. Breast self-exams. So the American Cancer Society says that this is optional, but if you think about it, your provider is doing a breast exam once a year. There's 11 months in the year where you can kind of stay on top of your own breast health. So we always recommend to do monthly breast exams. So they're done once a month. They're done 5 to 7 days after the start of your period. And if you're menopausal or don't get your periods, you can just choose a day in the month and stick to that day. So you can do a breast self-exam in the shower. Things are a little bit more slippery in the shower, so you can potentially feel a lump a little bit better, or you can do it lying down. And this is probably one of the instances where gravity is actually our friend with breast. So if you're lying down and gravity is helping, you might be able to feel a lump a little bit better. And just keep in mind for any women who are large-breasted, you can turn side to side so that you can kind of feel the sides of your breasts and kind of do a comprehensive exam. You also want to make sure to include under your arms for any lymph nodes. You know, just feel for any lumps or bumps under the armpits. Visualization can be very helpful as well. Not a whole lot of us like to stand topless in front of a mirror, but it could be helpful at least once a month. So it's best to kind of stand in the mirror, put your hands on your hips and kind of lean forward, backward, side to side. Just take a look. You know, if you notice anything different or anything just doesn't seem right, it's worth it to talk to your provider about that. And the whole point of doing a breast exam is to know what's normal for you so that you can report anything abnormal to your provider. So how to do a breast exam? There's a few different ways. First of all, you want to put your arm up or put your hand behind your head. And there are a few different methods, but each of those methods, you're going to take the pads of your middle 3 fingers. And in the vertical method, you're going to go up and down. The radial method, you're going to you can start from the nipple and work your way out and kind of work your way around your breast. And then in the spiral method, it's just going to be circles. So you can start from the nipple, do small circles and work your way out. And you really want to cover the areas from your collarbone down to your bra line. And just a reminder, you should perform your breast monthly exam a week after your period. So what are you looking for? These are kind of some things you're going to look for. Lumps and bumps, like we talk about, a pulled in nipple or an inverted nipple, any dimpling, any dripping from your nipple, redness or rashes, and then skin changes. So not just a change in coloration, but maybe skin thickening or anything like that. So what you want to report to your provider, like I said, any new lumps and bumps, nipple discharge, spontaneous nipple discharge, whether it be bloody or clear, changes in your skin, redness, swelling, dimpling, nipple inversion, skin thickness, and family history. So if your family is anything like mine, generation of my grandparents, they really don't talk about their medical history that much, but if asked a question, they will answer. So it's worth it if you have parents around, grandparents around, just to ask if there's any family history of breast or ovarian cancer. And they'll probably tell you the truth. And, you know, if there is, you can report it to your provider. And then you want to report any new pain. So any pain and tenderness before your period is very common, but it's good to know what's normal for you, what you expect to have, and report anything that's different. So there are a few different options for screenings. There are digital mammograms, 3D mammograms, or tomosynthesis, breast ultrasounds, breast MRI, and molecular breast imaging, or MBI. So a screening mammogram, this is kind of our starting point when we start screening for breast cancer. Yearly mammograms should start at the age of 40. Now, if you're older than 40 and you haven't had a mammogram, it's never too late. You could start anytime after 40, but typically we say we start at the age of 40. We start 10 years before diagnosis of first-degree relative, like a mother or sister. So for example, if your mother was diagnosed with breast cancer at 42, you want to start your screenings mammos at the age of 32. Some people are really afraid of the radiation that you get with mammograms, but there's less radiation than in a dental x-ray, so it's safe amounts of radiation. It's nothing really to be worried about. And then patients with BRCA or other mutations should begin at the age of 25 with mammograms and MRIs. So what is a mammogram? A mammogram is an x-ray of the breast performed in two views under compression. So you can kind of see in that picture there, the mammotech is helping the patient put her breast on the machine, and then the machine compresses the breast. And you get a top to bottom view and then a side to side view. A 3D mammogram takes multiple pictures and allows you to scroll through those images, and it picks up about 40% more cancers, more breast cancer. And in the images here, you can see the top two, this is a screening mammogram, and the top two images are that side-to-side image, and the bottom is the top to bottom. So a 3D mammogram or tomosynthesis, this is low-dose images acquired from different angles, and then those images are reconstructed into a 3D image. So there's advantages for evaluating masses and using this for women with a little bit more dense breasts. And a 2D mammogram can be used in combination with a 3D mammogram. An additional 2 to 3 cancers are detected out of 1,000 patients who are screened, so it's worth it to talk to your provider about 3D mammogram. And in these images here, you'll see this is a 48-year-old screening mammogram. On the left is a 2D, on the right is a 3D. And you can see right here in this area with the green circle, that area of concern. You can see that pretty well on the 3D, but it's hard to see that on a 2D. So as I said, it's good to talk to your providers about 3D mammograms. Mammography is the only imaging modality proven to decrease death from breast cancer. Other imaging modalities, including ultrasound, MRI, and MBI, are used in conjunction with mammograms, but not in place of mammograms. So that's why we say this mammograms are kind of your starting point, and we encourage women to start getting their mammograms at the age of 40. So what is a breast ultrasound? Ultrasound uses sound waves, not radiation, and the sound bounces off of the transducer to off the tissue and then returns to the transducer, and that's what creates that picture. So ultrasounds are used to work up problems, not really for screenings. And you can see the pictures here in the bottom. This is a woman getting a breast ultrasound. And these images here, this first one is a simple breast cyst, and this middle one is a fibroadenoma, and those are both benign. This last picture here is breast cancer. You can see in the imaging, the edges really aren't very well defined. So that's what breast cancer looks like. So why would we use an ultrasound? We use an ultrasound to characterize a mass on a mammogram. So if you have an abnormal mammogram, we use an ultrasound to follow up. It can be used to evaluate a palpable mass. Targeted ultrasound in the case of an abnormal MRI or MBI, often when mammogram is negative. So if your mammogram is negative, your provider may send you for an MRI. And if they do find something on that MRI, an ultrasound may be ordered just to take a better look at it. And then to evaluate problems associated with implants. Ultrasounds can be used for screening in patients with heterogeneously dense or extremely dense breasts, so category C or D, with or without risk factors for breast cancer. So that's the one case where we can use ultrasounds in screening patients. And then ultrasounds can be used for biopsies as well. So what is a breast MRI? A breast MRI uses a magnet, a computer, and dye to evaluate the breast. There is no radiation involved in this either. It's used for screening in patients who are high risk. It's used to work a patient with a discordant imaging. So if a patient feels something, but that mammogram isn't really showing what they're feeling, an MRI can be used to take a different view at it. And it can be used to work up patients already diagnosed with breast cancer, just to evaluate the extent of disease. Now, with an MRI, you can see in the bottom picture here, this is a woman having an MRI, and she has to lay face down, so on her belly, with her arms up, kind of in that Superman pose. And then this picture over here is what breast cancer looks like on an MRI. So molecular breast imaging, or an MBI, it's a nuclear medicine imaging of the breast, and it relies on differences in metabolic activity of tumor cells versus normal cells, because with tumor cells, there's an increased requirement, an increased metabolic requirement, so that it works in a little bit of a different way. Density of the surrounding breast is less of an obstacle, so women with dense breasts can get an MBI just to see things a little bit better. The indications for an MBI. So the indications are very similar to that of an MRI. So any patients who are at high risk, have a strong family history of breast cancer, have a personal history of breast cancer, those who have high-risk lesions on biopsies such as ADH, ALH, and LCIS, newly diagnosed breast cancer, just to evaluate the extent of the disease, any patients who are BRCA positive. It can be used as screening for women with breast implants. And it can be used in patients whom MRI is not possible. So very recently, we had a patient who has had a history of a stroke, and she tried her best in an MRI, but she just couldn't lay flat on the table with her arms up over her head. So they did order an MBI for her. And it also can be used in biopsy targeting. And these are the images here on an MBI. You can see right here is that area of concern. So how is breast cancer diagnosed? So after a mass is after a mass is palpated or an abnormality is seen on a mammogram, ultrasound, or MRI, a biopsy is recommended, and that's performed with a needle. So you can see the picture here is a picture of an ultrasound biopsy. That's the transducer and that's the needle. And in that needle, there's it's an apparatus where it can pull tissue out, and that tissue is sent to the lab. If there are any suspicious lymph nodes under the arms, that's biopsied as well. So just very quickly, there are different types of breast cancer and a little bit about staging as well. So breast cancer isn't just breast cancer. Every breast cancer is a little bit different, and these are the different types. So there's ductal carcinoma in situ, and this is where the cancer is still within the duct. So you can see the picture here. These are normal cells inside the duct. Down here, you can see the cells here, and this is DCIS. There's also invasive ductal cancer, where the cancer starts in the duct and spreads to the surrounding tissue. So that would be this picture down here, where the cells kind of go outside of the duct. And then invasive lobular cancer, which starts in the glands and spreads to the surrounding tissue. So rather than starting in the ducts, it kind of starts over here in the glands. And inflammatory breast cancer are cancer cells that have infiltrated the skin, and that's typically determined on a punch biopsy. So when we stage cancer, we also look at grade and receptors. So grade is how quickly or slowly the cancer cells are dividing, and it's graded 1, 2, 3. 1 is slower, 3 is faster. We also look at receptors, and we look at the estrogen, progesterone, and HER2, and these can stimulate cancer cell growth. So we look to see, what the receptors are in the percentage. Now, if you feel a lump and your mammogram is negative, you still need to follow up with a provider. That provider might want to order more imaging, like an ultrasound or an MRI or something. Most lumps do turn out to be benign, so don't be afraid. It could be benign, but a biopsy may be necessary just to rule out cancer. So this is a little bit about breast density, and it's nice to visualize this. So actually, in New Jersey, it's been a law for several years that we must report breast density on mammogram reports. So you'll see, if you have a mammogram, you'll see on that report your breast density, the category. And I believe PA is also the same. It's now a law. So you can see in these pictures here, the picture on the left, this is a mostly fatty breast. You don't see a whole lot of white. That second picture, you see a little bit more white, and that's scattered areas of fibroglandular density. This third picture is heterogeneously dense. So you'll see a lot more white, and it's hard to pick up small masses on this. And then this last picture is it's an extremely dense breast, and it limits mammography. So it'd be hard to find masses within all this white here. And then down here in these pictures, you can see a fatty breast compared to a dense breast. And you can see that little white area, which is the tumor on the fatty breast, but you'd have difficulty seeing that on a dense breast. So some radiologists will say it's like trying to find a polar bear in a snowstorm. It's just really difficult. And that's where we can use an ultrasound or MRI to see things a little bit better. So our breast cancer team advocates for women to reduce your risk and find cancer early. So ways to do this are to maintain a healthy weight. Do not use estrogen replacement therapy. Mammograms should be started at the age of 40. And then clinical breast exams should be done every year by a professional, at least once a year, if not more. And then breast self-exams should be done monthly. And please remember, when breast cancer is found in its earliest stages, the treatment is less and the survival rate is higher. It's really, really important to learn, to absorb, because that's why we say that early detection is very, very important. And just a little bit about our program here at Capitol Health. We do have a comprehensive breast care program. Our program is an NAPBC accredited breast program, and it has been since 2014. I'm very, very proud to say that our last accreditation was this past May, and we did pass with flying colors. So we did really well. So we continue to keep up with certain standards. So in our program, we do treat benign and malignant breast disease. In fact, we do have a breast designated physician's assistant who manages our benign breast disease as well as high-risk patients. All services are under one facility. So we have surgery, radiation oncology, medical oncology, all under one roof, but we also have our Oasis Spa and we have our wellness center that provides services not only to our patients in active treatment, but also for survivorship. And a lot of our patients do take advantage of that, and they really do appreciate that. We meet weekly for case conference with our multidisciplinary team to discuss all our patients. So any patient who's had a positive biopsy, we bring them to the table, and I kind of say it's a meeting of the mind. So it's not just one person determining the treatment, it's a whole bunch of people agreeing on a treatment. And we don't just make up our own rules, we follow national cancer guidelines, and we do participate in quality improvement. We just keep trying to make things better for our patients year by year. We do have a research department, and they are part of our multidisciplinary team. So they do have a say when we do meet weekly. And then we do have state-of-the-art equipment and current techniques. So a lot of our providers will travel across the country to go to different conferences to learn about the latest and the greatest. And they bring that back to Capitol Health. And they do that because they want the best for our patients and they want the best outcome for our patients. And that is pretty much all of my lecture tonight. Thank you so much for your time tonight and your attention. And please don't forget to schedule your next mammogram because early detection is extremely important. And I believe in the chat, I put my number and Trish Tatrai, she's our other breast navigator. I put our numbers in there. So if you have any questions or want to discuss anything, feel free to just give us a call at any point. Thank you.
Thank you, Aileen, for the fabulous talk. This is Melissa. I am one of the 2 oncology dietitians at Capitol Health Cancer Center. And I'm going to go ahead and share my screen there. And Aileen or Maggie, can you confirm that you see this and hear me?
Yes, I can see it and I can hear you.
Yep.
Fantastic. Thank you so much for joining this nutrition segment. I hope everybody had dinner before this piece, but for the next 20 to 25 minutes, I'll be speaking about nutrition and breast cancer risk reduction. So based on data released by the American Institute of Cancer Research, A third of breast cancer cases in the United States can be prevented each year. And so this equates to about 83,000 women in the United States. We're not going to be focusing so much on the non-modifiable risk factors, the things we cannot change, but I think Aileen did a really great job reviewing some of the data regarding these non-modifiable risk factors. Modifiable risk factors are the things in which we cannot change, that we can change, such as being overweight or obese, lack of physical activity, drinking alcohol, and smoking tobacco. That last pointer about smoking tobacco, what I will say is that smoking and secondhand smoke have been shown to increase risk of both premenopausal and postmenopausal breast cancer. And so the recommendation is to avoid smoking altogether. Okay, and so this is sort of the timeline that we'll be going through 4 basic pointers: body weight, eating a diet rich in plant-based food, physical activity, and limiting alcohol. So the first piece of this pointer is that excess body fat is increasing in the United States. So 30% of the US population is overweight, and 42% of the US population is obese, equating to almost 75% of the population falling within an unhealthy body weight. Adult weight gain is associated with increased risk for postmenopausal breast cancer. Excess body weight is not just being connected to postmenopausal breast cancer. In fact, 12 other different cancers, including esophageal cancer, gallbladder cancer, cancer of the upper stomach, pancreatic cancer, and colorectal cancer, as well as some GYN cancers as well. Obesity trends have increased in the United States. So in the 1960s, the obesity rate was less than 15%. It's now 42% based on 2017-2018 data. Being overweight or obese increases risk of breast cancer. And here's some of the background behind it. Many of us know that having excess body weight increases risk of heart disease and diabetes, but a little less about how it can increase risk for certain different cancers. So in the science of breast cancer, what happens is when we increase our body weight, we in turn increase a lot of times our body fat. And this causes an unfavorable shift in hormones. Estrogen increases, increasing risk for estrogen receptor positive breast cancer. Leptin increases, which is a hormone produced in our fat cells. Insulin increases and insulin growth factors increase, because as we gain weight, our body often becomes less insulin sensitive, meaning our body needs to produce more insulin to get the job done. And last but not least, adiponectin, which is a cancer protective hormone, decreases. Excess body fat also puts our body in a chronic low-grade state of inflammation, which in turn increases risk of cellular damage. And so this combination of shift in hormones, inflammation, can increase risk for breast cancer. What we eat, how much we eat, what we drink matters. So recommendation number 1, maintain and achieve a healthy body weight. It's one of the single most important things you can do to reduce your risk of breast cancer. In doing so, it's easier said than done, right? I'm the person behind the screen saying this, but when we go home or we end this lecture, it's really up to us, right? And thinking about what are some of our roadblocks: eating on the go, access to processed foods and fast foods, our other daily responsibilities outside of eating, general lack of time. The list goes on and on and on. But really thinking about what foods are you using to fuel your bodies and provide you with good nutrition, and are you moving enough to maintain a healthy body weight? And so I invite everybody to think about, what are your barriers? What are you willing to work on? What are you willing to strategize, with regards to eating healthy in your lifestyle, and sort of creating a mental list of something that you would like to change to promote a healthier you. It doesn't really necessarily getting a pen and paper, but really just making a mental effort to make those changes and implement those changes. Breast cancer prevention strategies also include eating a diet rich in plant-based foods. So in order to explain this, I included just generally a slideshow about free radicals and antioxidants. So free radicals are molecules that destroy the cell and can destroy the internal programming of a cell called your DNA. When a free radical hits a cell, it can cause a lot of damage, and some of those sources of free radicals include cigarette smoking, pollution, secondhand smoking. But one of the other things that can contribute free radicals is our dietary choices, alcohol, fried food, and processed food, to name a few. So when an antioxidant hits a free radical, it prevents damage to our cells, protecting our DNA. So the idea is, can nutrition provide these powerful antioxidants? Absolutely. So plant-based foods are foods that include fruits, vegetables, beans, nuts, seeds, whole grains. And these contain something called phytonutrients, which are plant chemicals. They lend plants with color, odor, and flavor, but they also can influence chemical processes inside our bodies in positive or helpful ways. So a diet rich in plant-based foods decreases risk of breast cancer. Fruits, vegetables, beans, lentils, nuts, and seeds. And I'll get into what whole grains mean, what whole grains exactly mean in a few minutes. So eat a diet rich in plant-based foods. This can provide the antioxidants to block free radicals, can reduce inflammation, can help regulate hormones, enhance our immune system, and help with our general weight management goals. I will say that over the course of time, our diets have changed in the US culture. We have shifted more from our proteins and our vegetables and our starches to more of a processed diet, such as hot dogs, pizza, sugar-sweetened cereal. And so I'm inviting everybody to really think about following the new American plate method, where 2/3 of your plate is plant-based food and 1/3 of your plate is an animal-based protein, if you do include animal-based protein in your diet. Cover at least 2/3 of your plate with fruits, vegetables, whole grains, beans, nuts, and seeds, and the rest perhaps with baked or grilled chicken, baked or grilled fish, or a vegan protein such as tofu, beans. These are some examples of the new American plate put to practice. And sometimes it involves making negotiations on a daily basis. So our plate might not exactly look like the new American plate, but making those negotiations so that you're not getting all those excess calories. So I promised to get back to what are whole grains. Whole grains are grains that are not processed. They contain all 3 layers of the original grain, including the bran layer, the endosperm, and the germ. And as you can see, the bran layer is really what contains the dietary fiber, the cancer protective phytonutrients, vitamins, minerals, and healthy fatty acids. When a grain is processed, the bran layer and the germ layer are removed, leaving just the endosperm. The endosperm contains proteins and carbohydrates, but it doesn't contain fiber. It doesn't contain the vitamins and minerals. It doesn't contain the phytonutrients or the helpful fatty acids. When you look at a nutrition label, you might see the term enriched refined wheat flour. That is not a whole grain. That is simply a refined grain where the layers are stripped, iron and B vitamins are added back in, and now you got enriched wheat flour. But you don't have the fiber and you don't have the cancer protective phytonutrients or the healthy fatty acids. And so this makes this grain inferior to a whole grain. Whole grains include things like oatmeal, whole wheat bread, brown rice, bran cereal. So I'm gonna go through a few slides real quick about examples on how to include and prepare plant-based foods, keeping in mind the new American plate method. Whole grains also include barley, such as barley soup or barley salad, quinoa, farro, lentils, like as used in lentil salad or lentil soup, beans, like chickpea salad, chili, and black bean soup, salad. Roasted vegetables are a great source of plant-based phytonutrients, as well as sauteed vegetables, just different ways of preparing vegetables to extract some extra flavor. It can get very boring to eat just steamed green beans every day or microwaved corn. So thinking about new ways of preparing your vegetables, including raw vegetables, perhaps during snack time, or pairing raw vegetables with a dip, such as hummus or guacamole. Fresh fruits, and also thinking about pairings of a fruit or vegetable with a protein, such as celery and peanut butter if you don't have a nut allergy, banana and peanut butter, or trail mix. A word about yogurt. Yogurt contains prebiotic and probiotic. Prebiotic is food for probiotic. Probiotic is bacteria. Our colon contains bacteria. What we want to do when we eat yogurt is ultimately that yogurt will help promote a healthy gut microbiome. 70% of our immune function is in our colon. So we really want to make sure that the healthy bacteria in our gut has the food to thrive. And so fiber provides this, which is found in your plant-based vegetables, as well as fermented products such as yogurt. Fruit and reduced cheese, that's another example of a plant-based snack and a healthy pairing. And also thinking about plant-based foods that provide healthy fats, such as walnuts, seeds, peanut butter, avocado, and olive oil. So these all provide healthy unsaturated fats, which are anti-inflammatory. And also thinking about plant-based foods with regards to spices, right? Instead of using salt, thinking about our tarragon, our rosemary, our dill, tarragon, fresh black pepper in lieu of the salt shaker. Physical activity. So with regards to physical activity, what does physical activity do? Well, it decreases risk of breast cancer by regulating blood hormones, preventing the buildup of body fat, and decreasing inflammation. So according to the American Cancer Society, as Aileen said, the recommendation is at least 150 minutes a week of moderate activity, or 75 minutes of vigorous activity each week. The difference between moderate and vigorous are defined as vigorous activities if you're doing something in which you're breathing very heavily, you cannot hold a conversation. Moderate activity includes something that you're doing that you can hold a conversation through, such as walking or dancing or perhaps swimming. So these are just some examples. Activity, like I said, helps regulate our blood hormones. It speeds food through our colon, reducing exposure to dietary carcinogens. So super helpful with supporting colonic health and preventing buildup of body fat, helping us achieve a healthier body weight. Now, the problem is that what do we want to do at the end of the day? Or what are we doing during the day? So thinking about our sedentary activities. So such as, mindless activities, being on the computer, watching television, and thinking about how can we squeeze in perhaps 30 minutes of extra physical activity each day, such as walking, dancing, bicycling, swimming, gardening, going to the gym, trying an oldie but a goodie type of physical activity, or something brand new. Last but not least, limiting alcohol. So alcohol increases risk of breast cancer. Alcohol is the third leading modifiable risk factor that increases cancer risk after cigarette smoking and excess body weight. Any amount of alcohol increases risk. So the recommendation is if you don't drink, don't start drinking. And if you do drink, watch your frequency and your portion sizes. It's really the ethanol, which is the alcohol found in alcohol. It's the ingredient found in alcohol that is recognized as a carcinogen, a cancer promoter that may lead to DNA damage. And that DNA damage can be worsened if you also cigarette smoke as opposed to cigarette smoke with when drinking alcohol. So alcohol can also help potentiate carcinogens to enter the cell, such as the carcinogens from cigarette smoking. So Any reduction of alcohol consumption will lower your risk of developing cancer. What is a serving size? I always like to think about that large glass that you could fit a whole bottle of wine in and say, that's a serving right there. It fits in the glass. But this is a nice little visual of what a serving of alcohol looks like. A 12 fluid ounce can of regular beer, 8 to 9 ounces of malt liquor, 5 ounces of table wine, and 1.5 fluid ounces of 80 proof spirits. And as Aileen said, a serving is equivalent to, for women, if you do drink, you really want to limit how much you drink. And if you do drink, 1 serving would be the preference. For mothers, breastfeeding your baby can help both mom and baby. Evidence strongly suggests that breastfeeding can protect mothers by lowering their personal risk for breast cancer. And studies also show that breastfed babies are less likely to become overweight or obese later on into adulthood. Do not use supplementation for cancer prevention. There is no one supplement that has been independently proven to decrease your risk of breast cancer. And also of note, it's the synergistic effect of the minerals, the vitamins, the fiber, the antioxidants, and the phytochemicals that really have the best effect in reducing your risk of breast cancer. Common questions that I wanted to sort of end with, and some common questions from patients that I have. I want to say this is number one question that I get from all cancer survivors is, does sugar feed cancer? Well, of course, if I put in Google and ask AI, does sugar feed cancer? Yes, the answer will say yes, because technically, yes, sugar does feed cancer. All of our cells in our body, including cancer cells, need glucose to survive. So let's say, for instance, that you decided to go on a 24-hour fast. Your body will convert muscle and fat into glucose, sugar, to continue to fuel our involuntary processes, such as blinking, digestion, breathing. So in other words, there's no way to starve a cancer. However, where did this saying come from? Yes, sugar feeds cancer, but it's not really useful because metabolically, our body's always going to want that glucose to stay alive. It came from the fact that eating a diet rich in high sugar foods, including the processed grains, increases the likelihood of taking in more calories than you need. And this leads to unintended weight gain and increased body fat. And it's really the weight gain and the body fat that is associated with increased risk for breast cancer. Does high sugar diet increase risk of other things such as diabetes? Absolutely. But in the connection of cancer, it's really the weight gain associated that is the negative factor here. Are soy foods safe to consume? This is a common question from breast cancer survivors. Soy foods include soybeans, edamame, tofu, tempeh, soy nuts, soy milk, soy yogurt, and miso. Let's talk about the soy food benefits. So soy foods are anti-inflammatory. They contain antioxidants as well as natural plant chemicals or phytonutrients called isoflavones. They protect our DNA. They promote gut health by increasing microbial diversity in our colon. And soy foods are also cardioprotective. Key message here, soy foods do not contain estrogen. So yes, soy foods are safe to consume, and most observational studies reveal the following. Increased intake of soy isoflavones reduce risk of breast cancer, and the evidence grade is graded as a probable. Risk reduction is associated with isoflavone consumption in the amounts of 1 to 3 servings of soy foods a day. Up to 3 servings a day is safe based on long-term intake of up to 100 milligrams of isoflavones per day in Asian population studies. So what does 100 milligrams of isoflavones look like? Well, down below, 1 serving of whole soy food will provide 25 milligrams of isoflavones. So for example, a glass of soy milk is equivalent to, or 1 cup of soy milk is equivalent to 25 milligrams of isoflavones. So if you like soy, you can continue to consume soy. And if you don't like soy, it's okay. It's just good to know. I'm going to end with some inspirational quotes. I cannot change yesterday, but I can change today. Maybe not looking back, looking forward and seeing what you can do. Transformation is a present activity, not a future event. So this just means that, you know, we might think, oh, I got to get down to this weight. I got to eat perfect, but perfect is not attainable. And also when, let's say you do achieve that weight, it's still important to eat healthy, right? It's a present activity. It's not something that's going to happen and then it's done. So, and also it's important to be proactive, not reactive. The 80-20 rule, if any one of you out in the audience have ever heard of this, it basically means that what matters the most is what you do most of the time when it comes to healthy lifestyle. So if 80% of the time you're choosing healthy foods, eating a balanced diet, that's what matters the most. The 20% is really when you're allowing yourself to live a little. Oh, you can have a pizza. Oh, you can have a slice of cake at a birthday party. Absolutely. If the majority of the time, roughly 80% of the time, you're including foods that are going to provide cancer protective benefit. Small changes can equal big results. Some of the resources that I included here include the American Institute for Cancer Research and the American Cancer Society. There's also a great oncology nutrition dietetic practice group, but that is part of the Academy of Nutrition and Dietetics. And as a visitor to the website, you don't need a membership, and that's oncologynutrition.org, the Environmental Working Group, and the National Center for Complementary and Integrative Health listed here. I thank you, everybody, for your time. And Aileen and I invite any of our participants to put questions into the chat. Thank you so much.
Thank you, both of you. And just a reminder, if you could please complete the evaluation, which is found in the chat box. I also put, this is being recorded, so there is a website for that. And I also put Aileen and Trish's phone number if you do want to contact them. So you're welcome to ask questions. Either unmute yourself and ask the questions, or you can put them in the chat box.
Yeah, so I see a question here. If you have dense breasts, would it be better not to get 3D mammogram and get the more definitive one? So you really should start with your mammogram. There's 2D and 3D. You can request a 3D, ask your provider just to put that in. I also recommend also talking to your insurance company to see who covers what. And then if they find on that mammogram that they really need to look a little bit different or need different imaging, then the radiologist will make recommendations and your provider can order the right study.
There's another question. Would you recommend genetic testing if parent had pancreatic cancer and grandmother had breast cancer?
I would. There is, if a parent and grandmother, yeah, I would. It's not the same cancer, but there is cancer in the family, and it's worth it to just call the genetics department, talk to a genetic counselor. They'll do a full intake and determine whether or not you should really have genetic testing.
Okay. Any new information on eating foods with soy isolates?
Hi. Yes. So soy isolates are often found in like processed soy products such as veggie burgers. And this would be safe to do. It just contains a little less isoflavones than your whole soy foods like your soy milk and your tofu. So perfectly safe to do, just not as strong or powerful in that soy isoflavone content.
Okay, I think this is another one for you, Melissa. What foods are good to help increase bone density? I have bone loss due to the medication I am on, anastrozole. I probably did not pronounce that right, but
Oh, thank you. So yes, common question. I would encourage a couple things. First and foremost, when you see your primary care physician for your annual wellness visit, you can inquire to see if that physician can order vitamin D tests. It can be ordered annually in your blood work. Most insurance policies cover it. And basically, you can see if your vitamin D levels are within healthy range. Vitamin D is involved in protecting our bone density. So if you're deficient, this would be super helpful to identify if you're deficient or not. and to basically decide on if you need to start vitamin D supplementation and what dose would be appropriate. As far as the other piece of the puzzle, with regards to bone density, that is calcium. So calcium is involved in our bone metabolism. Some dietary sources of calcium include milk, cheese, yogurt. You do get a little bit in non-dairy sources such as broccoli, almonds, oranges. Also, if you do drink orange juice, calcium fortified orange juice contains about 300 to 400 milligrams of calcium. And also milk alternatives like almond milk and soy milk are typically enriched with calcium and contain about 300 milligrams per cup. For women who are less than 50 years old, the recommendation is at least 1,000 milligrams a day of calcium. And for women who are greater than 50 years old, the recommendation is 1,200 milligrams of calcium a day. Each serving of dairy provides 300 milligrams. And so if anyone's ever heard, aim to have 3 servings of dairy a day, that's where that came from. I will note that although dairy is a great source of calcium and vitamin D, it could also be a big source of saturated fat. So the American Institute of Cancer Research is very careful and mindful of their vocabulary and typically suggests reduced fat dairy, such as skim milk, 2% milk, or reduced fat cheeses and reduced fat yogurt.
Okay, another question. Would you recommend genetic testing if mother's sister had breast cancer and died of it?
So maternal aunt had breast cancer. That's just one family member. Typically, they look for a little bit more. I don't know if there might be a little bit more in the family, and it's not a first line relative. So it's not a grandmother, a mother, or sister or daughter. But it is worth talking to your provider just to do, just to run a high risk assessment. There is a high risk calculator out there that can be done. So, it's worth it to talk to your provider, and then they can determine if they want to refer to genetics, because most providers do know the guidelines for recommendations.
Okay. Should my 32-year-old daughter have genetic testing if her aunt and grandmother on husband's side had breast cancer, rather than wait for 40-year-old mammogram?
So the daughter, if the daughter's husband, am I getting that right?
It's in the chat, so I don't know if
Oh.
who.
Okay, I think she's put yes. So no, it just
Okay.
a blood relative. So if it's a family member that they're married into, so on the husband's side, it's not in the bloodline, so I really wouldn't be too concerned. If there's any other family on your daughter's side, so whether it be on your side or her father's side, then it'd be good to talk to your provider about that.
Okay. Next question, is turmeric okay to consume?
Yeah, so turmeric is an Indian spice. It contains a powerful antioxidant called curcumin. You can find it in your spice aisle at the local grocery store. Many people use it in chili, on top of their eggs, generally just to add flavor to any dishes. The good thing about turmeric is that when turmeric hits the colon, it exerts powerful antioxidant benefits. So there's a lot of research out there regarding turmeric intake and reduced risk of colon cancer. So I suggest if you're going to do turmeric to get it, in the spice aisle at the grocery store. Turmeric supplementation might be helpful for various medical conditions, but I wouldn't recommend it necessarily exclusively as a supplement to take to prevent cancer.